Mic on. I'd like to bring to order our Washoe County District Board of Health meeting for July 27, 2023. Can we have a roll call?
Yes. Chair Adair?
Here.
Commissioner Garcia? Here. Michael D. Brown? Dr. Dinko? Here. Dr. Clacking?
Here.
Dr. Novak?
Here.
And I'm your recording secretary, and we have a quorum, Chair.
Would you please stand for the Pledge of Allegiance? And Mr. Novak, your arms are working fine. Would you like to lead us?
I'll do that. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, that brings us to the approval of the agenda. I did hear we have something we need to read. Is that not till public comment, or is that when you're thinking? Okay, thank you. So we are looking for the approval agenda, or if somebody has something they'd like to take out of order. Or
Make a motion to approve.
I have a first, I have a second. All in favor?
Aye.
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 Very good. And if you're here, Dr. Clacken, thank you for being here. We'll go ahead and vote for you down here on with the computer.
Thank you.
Your eye works just fine.
Thank you.
You're welcome. We're going on to recognitions. So I'm going to hand this over to Kevin Dick, and please, sir, lead us on. We have a few wonderful things to do today.
Thank you, Chairman Dare. I'd like to begin with years of service. I want to recognize Kathy Sullivan. Kathy, if you could please stand. Kathy is with our Vital Records program. She's been with us for 5 years now. So thank you and congratulations.
Good job.
And everybody stick around. We'll take some pictures when we get through the recognitions. Also recognizing Will Lumpkin. And I don't believe that Will is here today. He's been with us for 15 years in EHS, and he's leading our vector program mosquito efforts. So I think he is busy out in the field at this point. And we have also several new hires, all of them in CCHS. So I'd like to ask Lisa Lotritz if she could do introductions for us.
You brought your own gang with you this time.
Okay, let me put these in order real quick. Okay, yes. Hi, Lisa Lotritz, Division Director for Community and Clinical Health Services for the record. I will start with Carla. Carla Aguirre Camargo comes to us from ARUP Laboratories as an on-site client liaison for Renown Regional Medical Center. Previous to this, she worked at St. Mary's Renown and Vitalant Blood Donations Center as a lab assistant phlebotomist. Carla sought out this opportunity to further assist those in her community. Overall, healthcare has been her calling, whether it be behind the scenes or in customer service. She believes helping and taking care of others is important. She's excited to further advance her knowledge in the healthcare systems and continue to help her community in her new position at the health district. Carla is joining our immunization team as an office specialist. Okay, and then next we have Anna Richardson. Anna is joining our sexual health disease investigation team. And Anna was born in Michoacan, Mexico, and spent her childhood in California before moving to Reno with her family in 2000. Growing up, Anna enjoyed the arts and expressing her thoughts and experience through painting and photography. Anna went on to study art in college, graduating with a Bachelor of Fine Arts from the University of Nevada, Reno. Though what she found to enjoy most was working in outreach and helping families in need. This led her to pursue a career in law enforcement, in which she proudly served the community for nearly 8 years. Some of her most memorable times were serving as a hostage negotiator and as a member of the detention center unit, where she helped inmates prepare for a successful life post-release by connecting them with various community resources. Anna has enjoyed working in public safety and is excited to start her new journey working at the health district and continue her help to help our community stay safe and healthy. And last but not least, Stephanie. Stephanie is joining our WIC team as a human support specialist. Stephanie Human Support Specialist 1 in the WIC program, and her primary location will be at the Moana WIC. During her training, she'll go back and forth between Moana and 9th Street. She was born and raised in Reno and has experience in healthcare and public health through positions working in medical records, radiology, billing, and most recently front desk intake at Northern Nevada Hopes. She's pursuing a degree in human development and family science, which aligns with working with families in WIC. She is interested in this degree because she wants to help others, especially underserved populations, by providing education and resources that allow people to thrive. Stephanie is excited to be a part of the Health District and the WIC program where she can provide services and benefit our community. So welcome.
Well, I wanted to tell you on behalf of the board, we hope that you found yourself a wonderful place to work. Not that the last place wasn't good, but this is going to be better. And that you can grow here and you can thrive and become all the desire of your career. So thank you for being here.
All right, next I'd like to move on to promotions. And I think the Health District is being viewed as a department here at the county that has got high quality employees and are developing those employees. And as a result, we are experiencing a number of our employees, they're receiving promotions that are in other county departments. So sadly for us, but good for our staff that they have these development
We can also say they're
opportunities.
stealing them from us.
But we have four staff this month, and we had a number of staff last month leaving us through promotions. So Amy Santos from Office Support Specialist in EHS is moving over to the assessor's office, or she has. Manuel Coronado, who was with the immunization program, has moved over to the district attorney's office. Nanette Kano, who was an office support specialist with air quality, has been promoted to a position in Human Services Agency. And Jackie Lawson, who was an admin secretary in epidemiology and public health preparedness, has been promoted to a position in animal services. So congratulations to all of them.
Jeff. And
we'll be working on trying to fill those positions. And we have two resignations. Eric Lamon, who was an environmental health specialist in EHS, has decided to join his father in the family business, and also Ashley Humes, public health investigator in CCHS, has resigned from the Health District. So I wanted to recognize both of them, and also just wanted to point out in particular, Eric Lamon was fairly new with the Health District when the COVID epidemic hit. We'd gotten him from Animal Services, but he stepped up in a big way and was actually the person on the ground running the post-testing operations during that first year of the pandemic. And then we have Washoe County Health Hero to recognize, and that's Yara Diavla, who, if you could, is Yara here? There she is. Oh, in the back, in the comms section. She's in my office, one of our communications specialists, and she's been recognized for adaptability and collaboration. And then we have a special recognition today, and it's something that Chairman Dare wanted to have for recognition, which is a Chair's Recognition Award, and this one is for Joelle Gutman Dodson. And Joelle, maybe if you can
Come on down.
get in front of the glass. I miss Lisa.
Kalisa Shireen. Kalisa Shireen is an honorable mention.
Honorable mention, correct. Okay.
Yeah. Well, come on down. So one of the things that I hope to do wherever we're at is just to really make sure we're celebrating some of the good work everyone does. And so don't get me wrong, everyone does great work, and then every once in a while we can see someone go up and beyond. And I think this legislation session was quite fun, and we saw you really pull some things together that helped us at large and represented us very well. And so I know there's times on the phone you might wonder if I thought that, because I'd be pressing or pushing, and I appreciate you listening to the things we shared and then going and getting it done in a way that worked. But we do have actually a really cool award for you that just says for outstanding performance on behalf of the Washoe County Health District. And so I'm honored. This is the first Health Chairs Award, I think, in history that we're giving out that I know of. And so I'm honored to get to start something new and fresh. But we're just kind of keeping an eye out on people that we want to recognize, and we wanted to give this to you.
Thank you. Appreciate that.
Very good. You want to share anything about some of what that looked like?
Oh, yeah, I just wanted to thank Joelle and grateful for her efforts. It was quite the session. And we did, one of the best sessions that we've had as far as the support for public health, the new public health improvement funding, as well as some other bills that moved through and received the governor's signature that we really didn't know were going to be able to make it. And so Joelle was just relentless throughout the session. Working hard, not always in the foreground, but always down there and working it on our behalf, and went through the emotional roller coaster that goes along with that at the end of the session, but came out on top with our legislation. So
when we visit your house, we expect this on your wall somewhere. But I think we're ready to go down and take some pictures.
yes, I think we are.
Thank you so much.
there anything you wanna say?
Appreciate that. Oh, I'm still trying to summarize what that experience was this session, but I can honestly say I've never worked harder for something. SB 118. That's it. That's all I have to say.
Well, it was recognized. Seriously, we saw you working very hard, so we appreciate it. Come on down, everybody. Takes up all the sleepless nights, early morning drives in the snow.
Days away from her family.
Three, two, one. Got it?
If you see another 5 years for your 10-year plan, is that how it works?
Thank you.
Congratulations.
Thank you.
All right, here we go. Three, two, one. Got it?
Thank you.
It's new hire. Come on in. One day you can run this place. I know it.
Here we go. Three, two, one. Got it?
Welcome.
Thank you.
Central? No, it's like a super small town. Okay. Welcome. Okay, we are moving on to public comment.
Yes. And we'd just like to make a quick announcement. This meeting is a hybrid meeting, so it's also held via Zoom. So to attend virtually or telephonically, we would have to use our link or the phone number that are listed on our agenda. To do that, you would visit zoom.us and enter meeting ID 820-9018-1273 or dial 1-669-900-6833 and enter the meeting ID 820-9018-1273. And Chair, we don't have any registered public comment.
No public comment. All very good. So all those millions of people watching, if you ever want to do public comment, that's how you do that. So we are moving on to consent items. Would anybody like to pull a consent item or make a motion? We have our motion. Do I have a second?
Second.
I have a first and a second. All in favor?
Aye.
Any opposed? John, you're good with our consent?
Yes.
Very good. Would everyone vote on the computer? And that passes unanimously. And we're moving on to our, let's get past all that. Regional Emergency and Medical Services Authority recommendation. We'll let you get to that part, but welcome.
Thank you, Mr. Chairman. Good afternoon, members of the board. Adam Hines, Chief Operating Officer for REMSA Health. Before you have our monthly franchise compliance report. In addition to that, I'd like to share, particularly relevant to this board, because you govern the rates in which we are able to charge for transportation services. I think it's important for this board to understand something that Barry and I and our organization is very proud of, which is 63% of that money goes back to our employees, specifically to our employees. And something we've been working on that I'd like to share. As stewards of that fund that we receive from those fees, I want to highlight our commitment to our team members and their behavioral wellness, which is obviously a topic of conversation across our industry. Over the past month and a half, we've increased our budget and spending towards behavioral health of our employees by 80%. Increasing accessibility and the diversity of those programs. This includes programs such as traditional EAP or Employee Assistance Program, where clinicians are available 24 hours a day, which probably many of us are familiar with, but also we've partnered with the Nevada Peer Support, which includes an embedded mental health clinician who will provide a certain number of hours to our organization for things like ride-alongs, to interact with crews, individual sessions, and assistance with major events. This is in addition to continuing our work with Heidi Martin, who previously worked at our organization as a field provider, as a paramedic and EMS supervisor. And I think many of you on this board, being medical professionals, clinicians, have out-of-hospital experience, know that it's important when these men and women need help. It's very important to connect with somebody that is relevant and has specific knowledge to many of the things in which we do every day. Both of these people are obviously culturally competent to provide relevant and relatable support and a unique understanding of the situation and work environment. In addition, our peer support team, which was pretty much non-existent, is more active than ever. It has been supported by many of the agencies within the Valley, and so they provide not only their expertise and support when we needed them, but also helped our team get up and running. And currently we have 35. We intend to grow to 65 individuals, and we want to ensure that we're reflecting all of the divisions and diversity of our organization by including those team members in that manner. From an administrative perspective, we have worked really hard with our health insurance provider to form relationships with trusted behavioral health clinicians in our community so that our team members have access, which is limited, and we know that. And then finally, other projects that are kind of on our horizon, on our wish list that we are actively working towards in the early stages is obviously spiritual leaders, including them as part of that process, creating more benefits around physical health to adjunct mental health, as well as virtual tools such as meditation or the Calm app. And so I want the confidence of this board to know that the monies in which we are receiving is working to support the health and wellness of our team members that are caring for our community every day. And so with that, thank you for the extra time, and I'd be happy to answer any questions that you may have.
Any questions? I have one. I just wanted, do you have a small update just on how employment and team members, it's been a little while since we kind of heard from you, and I actually, as a city, we've seen a little uptick on people wanting to, from police to fire, and so hopefully you guys are seeing that same uptick.
Yeah, actually, I think I reported a couple board meetings ago that our shift lines are at an all-time high as far as the number of shifts in which we have deployed within our community. I think it's 67. My operations team is probably listening and maybe correcting me, but it is at an all-time high, which is obviously good for the community and good for REMSA. Some of those strategies include recruiting individuals from across the nation. We've talked that there are not paramedics in the shadow of our community. Our Center for Pre-Hospital Education is working very hard at recruiting individuals, and actually some of the graciousness of this board supporting scholarship opportunities through the penalty fund, so that individuals that have interest in a career in EMS have the ability, at least financially funding, to go to an EMS accredited program, so growing our own. But the other focus is, and in fact, yesterday I was on a webinar that spoke specifically on the need for us to focus on recruitment. And things like investing in the behavioral health. We, a couple months ago, launched an employee communication tool that allows for us to engage with a generational workforce that is 24 hours a day, 7 days a week. They don't read emails. They want to be able to like, share, and comment. And what we have found is a lot of great engagement with that transparency and commitment to communication. And so I think those, coupled with that work, and then obviously our work that we have done on our pay scales and we continue to do, is likely the position that we're in, and it seems to be going in the right direction.
Fantastic. Thank you.
Thank you.
Appreciate it. We just need an acceptance of this.
Mr. Chair.
Yes.
There we go. I just wanted to say thank you for increasing your budget and your programming and your focus on the mental health services that you're providing to your staff. I was taking a tour of dispatch the week before the care flight accident, and after knowing the loss of lives that day and just realizing how everybody there had to continue to show up to work, despite their grief, despite the loss, the whole community felt it. And I know that the folks that had the boots on the ground every single day that loved and knew these individuals were really, really hit hard. So I commend you for your efforts, and taking care of our staff is always very, very important. So thank you. And with that, I move to accept the report.
Thank you, Commissioner Garcia. And we have a second.
I'll second.
We have a second with Mike. And all in favor?
Aye.
Aye.
Any opposed?
Aye.
And vote on the computer if you would. And that passes unanimously.
Thank you.
Miss Alexia Jobson. And she'll be doing the update of health's public relations during June 2023. REMS Health.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for the record. You have for your review June's public relations report, and I'm happy to share a few more updates with you. REMSA Health accommodated a couple of media requests throughout the month of June for heat-related subject matter, including having COO Hines provide a live on-air interview with National Fox Weather Service. He shared tips for staying safe in the heat, as well as general summer holiday advice, such as avoiding fireworks and drinking and driving. REMSA Health invited and hosted a couple of guests from the Nevada Women's Fund for a tour of our campus recently. They were thrilled to learn more about our organization and the ways we care for, transport, and educate community members. And finally, earlier this week, COO Hines participated as a panelist on a national webinar hosted by the Academy of International Mobile Healthcare Integration, where he shared data and spoke about the benefits to the community of having a high-performance, high-value EMS system like REMSA Health. I'm happy to answer any questions.
Very good. Any questions? You know, the only thing I just encourage you to do is find ways, if we could get you into our cities and our county, just continue explaining. We get to hear it here, but it's nice that the rest of our council and people get to hear it too. So I think it's been a little while since we've seen you at council, so I'd probably request that.
Okay, very good, thank you.
Thank you.
We'll get on the agendas in the coming months.
I appreciate it.
Okay, thank you.
Thank you. We do have, moving on to number 8, recommendation for reappointment to the Food Protection Hearing Advisory Board. As a committee member, staff recommends the reappointments of Mrs. Lanai Elkins. You want to go and explain?
Yes, good afternoon, Mr. Chair, members of the board. For the record, Amber English, EHS Supervisor. So the item that you have before you is staff's recommendation to reappoint Ms. Lene Elkins to the Food Protection Hearing Advisory Board for a 3-year term, retroactively beginning July 1st, 2023. As you may remember, last June, the board recommended Ms. Elkins serve a 1-year term on the Hearing Advisory Board, and her appointment expired June 30th, 23. In addition to Ms. Elkins, we did receive one additional application that you can see in your packet. Since her appointment last year, Ms. Elkins has not had an opportunity to serve on the board because we haven't had an appeal or variance meeting since then. And our recommendation is based on her extensive experience in the food and beverage industry at local resorts and casinos, as well as the associated outdoor events. We just think she'd be a great addition to the Food Protection Hearing Advisory Board. And with that, I'll answer any questions.
And I just want to say for the board to remember, and for those, so you know, we went through an extensive thing a couple years ago where we made sure that every board time something open, it went out to the public. In this instance, I'm going to agree that the person came on and it was a very short length. And so I don't think there's much to look at there. I think we want to give her that opportunity, especially with your recommendation. But we do want you to know that there was a time where we felt like we needed that to be more robust. And I think you guys have done that, so thank you. So with that said, any other questions?
Mr. Chair, I move to approve the reappointment.
We have a first. Do I have a second? I have a second. All in favor?
Aye.
Any opposed?
Aye.
That passes unanimously. Thank you so much. Please vote on your computers. We are moving on to number 9, recommendation to approve the new Corn Ferry wage range for both the district health officer and the district health officer with MD classifications. As they come up, I just want to kind of set the tone for this. Though it does pass through us, and obviously we can vote, and you individually get to vote how you want. This is really a county process that they went through, and so we are kind of agreeing to and stamping the large process. I'm not saying that the county wouldn't be unhappy if we said no, but they probably aren't going to be very excited. But at the same time, they did go through a lot of process, and I know that's what you could partly explain to us, so thank you.
Absolutely. Good afternoon, Mr. Chairman and members of the board. For the record, my name is Jag Zentino, and I serve as the Administrative Health Services Officer for the Health District. So the item before you is a recommendation to approve the new Corn Ferry wage range for the District Health Officer position with and without a medical doctor degree. So the Board of Health has responsibility for approving all wage and salary adjustments for the health officer position. And just a little bit of background on Corn Ferry. So the intent was to restructure and streamline the classification and compensation program and improve alignment around both market competition and best practices. And the county has not completed a classification and compensation study since 1999 prior to this. And the recommendation aligns with a pay range of similar positions within the county. So we make a recommendation to approve this item, and happy to answer any questions.
So any thoughts, concerns, questions? Okay. One of the things I would speak to, and part of why I'm in favor of this, is no matter what, and I know there's some, when you add this all up, might have questions, but of what somebody's paid and things, but we have to stay ahead of the game and make sure that if one day this gentleman decides, hey, I'm going to go fish more, and so we have a new somebody, we need to stay and make sure we can be competitive in nature, and that's with each of our things. So we want to make sure we stay right there so our region can always be competitive in that nature. So with that said, I'm looking for a motion.
Make a motion to go with staff's recommendation.
I have a first. Do I have a second?
Second.
Second, John Clacking. And all in favor?
Aye.
Aye.
Opposed? That passes unanimously. Thank you so much. Appreciate your work. Review of the bills that passed the 2023 legislative session that impacted the Washoe County Health District. We're going to bring back up, I believe, Joelle Gutman-Dotson?
No, everybody's dying to hear more about the legislative session. But I wasn't here in June, so I did want to give just a really brief update. This isn't formal. If you would like something formal, I can do that for you. I did want to just thank you, Chair Dare. Sorry I didn't thank you earlier. One of the reasons why I think some of our conversations can be tough those Friday mornings or whenever is because, you know, you have something different to look at and think about as the chair. And I have the political piece, and Kevin had the public health perspective piece, and sometimes those can all gel, and sometimes they don't gel. And so it really is such a team effort. I may be the one down there, but it takes all those perspectives, and it takes everybody's input and push. And so thank you for the award, but like we did that. We all did that, as well as I always have to shout out to my bestie, Bradley Mayer in Southern Nevada Health District. Couldn't have done it without him and a lot of other people as well. So anyways, moving on. I'm just going to do the ones I did this in our DD Soups meeting last week. Just the ones that I think you guys we were most involved in and probably impacted us the most. This first one is AB 53, and that increased penalties and the violation structure for underage sales of tobacco products. We didn't get it as far as we wanted, but it did remove the first warning for a violation, and it upped fines very, very significantly. So the first violation went from a warning to $2,500. The second, $5,000, the third, $7,500, and the fourth, $10,000. Although they will never, it's physically impossible to get to a third violation, but someday we will work on aligning the fees with the timing. But that was signed by the governor, and that becomes effective January 1, 2024. SB 92, which I think you've probably all heard a lot about on the news. This was from Senator Danyate, and this sets forth requirements for licensing and regulation of street food and merchandise vendors by the governing body of certain counties and cities, meaning Washoe and Clark, as well as City of Sparks and Reno for us. So the bill also creates a task force for a safe sidewalk vending group in the Secretary of State's office. And the task force will be required to review existing laws relating to sidewalk vending and recommend new approaches to improve the laws the city, states, and counties have to simplify and standardize. This bill got really murky. It still is murky, as you can see on the news. They're saying like street food vending is finally legal. It's always been legal. We've always had a mechanism to get there. It is arduous. There's a lot of different licenses. It didn't change much from the public health perspective. They still have to maintain all of their food and safety standards, as well as have a properly equipped food cart. However, it does take away our ability to criminalize it or cite it, which we weren't doing anyways. I'm looking at you, Dania. We weren't doing anyways just because it was creating problems. So the 9-member task force is made up of a representative of a health district, either north or south. We are hoping that position will be from the north. A representative of a county or city that works in business licensing, a gaming or restaurant representative, law enforcement, and a member of an employee of the Secretary of State's office, as well as 4 members at large chosen by the SOS that have to do with sidewalk vending. There was a group very involved called Make the Road. I assume most of them will be coming from Make the Road. The bill also created more boundaries for street food vendors. So they're prohibited from being anywhere within 1,500 feet of a resort hotel, an entertainment district, an event facility for seating 20,000 people or more, a major minor sporting events team, a convention facility, as well as giving counties and cities the ability to prohibit in front of a farmer's market, a polling place, a religious institution, a childcare facility. It goes on and on. So the real work is going to be done at the city and the county level, I believe, and for Washoe County, mostly at the city level, because Washoe County, there's not a lot of places we have street food vendors. It's mostly in the city of Reno. So we do have a meeting set up with the city of Reno, and I believe the city of Sparks as well. That'll be Monday. With the business licensing folks from both, as well as their government affairs team and a couple representatives from our EHS team will be on that call on Monday, just to see how we will proceed. We've already had an incident that got physical this past weekend when the city of Reno and our EHS team went out and tried to regulate street food vending where they shouldn't have been. So that's SB 92. Any questions there?
I just want to speak to for a second because for me, one of the concerns that I had is the overreach of legislation into our business on this. So, but part of that, if we aren't paying attention and we don't, and someone feels like we're not opening the doors or educating or honoring the different cultures who'd like to do this, then they'll step in and try to come up with answers. That's kind of typical of what legislators do a lot of times on that kind of stuff. So when it comes to this, I do think we should find ways, and I know you're doing this because we've already talked about this a little bit and wherever this sits best, of making sure that we are doing stuff to educate in our community. Because if we're not careful, what was just legislated actually tries to tie our hands more than I think I'm even interested in. It sounds like a Las Vegas bill anyway with everything you just said. So really, I don't know that it affects us all that much, but the problem is the overreach can continue to grow. And so, but if we aren't doing anything about it, then maybe their overreach is acceptable because we're not involved. So that's, I just want to say on that particular bill, I do think that our area with environmental health, I believe, we just need to continue to walk this out and find good ways that we already have the answer. So if they try to upgrade or shift, we can push back and say, we're good.
Yeah, this was a tricky bill because the whole time we were like, we have the licensing structure, and we recognize that maybe we can lower some barriers of getting to it, payment plans or alternatives to driver's license, things like that, but we can't ever lower food health standards.
Yep.
So a lot of this is coming from licensing at the city and things like that. Unfortunately, I think this made it more complicated for street food vendors, not less. We will see how it unfolds these next 2 years. With SB 92, we are required, if the task force recommends regulation changes, to make them by December 31st, 2025, which means there'll be another session before that. So we will see how this bill unfolds and if it needs to be corrected next session. Otherwise, we're open to seeing how regulations can improve our system. However, we will never lower our food standards. So interesting bill, TBD. That's all I have to say about that one. SB 118, I think we all know about it. This bill allocates $15 million to DPBH to be allocated to the 3 health districts in the state and DPBH as well, or their designee. So we put designee in there for Carson City because they aren't technically a health district, but they serve as one. So 73% will go to Southern Nevada Health District. 1.3% will go to Central Nevada. We will receive 16%, and the remaining 9.7% will go to DPBH, with 2% of that being Carson City's. So the money will start in the fiscal year 25 or July 1 of next year. The bill also removed the word adjacent to allow Central Nevada to form a health district with a county that wasn't directly adjacent to Churchill County. There are reporting requirements, as well as it's not in the bill, but what was important that we got on a record several times several times at the end was that there's legislative intent that this will be continued and this will be budgeted in the governor's budget, which is our next big lift for these next 2 years of the interim, is we need to get this sustainable and ongoing, which was the goal of the whole bill the whole time, and we had to get rid of it to get it across the finish line. But there's legislative intent. So we'll be continuing the work of SB 118. SB 232 I didn't have a lot to do with, but I do think it's still important for public health. It requires the state plan for Medicaid to include coverage for postpartum care services for 12 months. That was an increase from 60 days. So that's a very important maternal and maternal health legislative priority. SB 172 was a bill I think Kevin was mentioning that we were not certain that would get signed by the governor, but it was. We owe a lot of help with that bill to Jen Howell. This was a bill recommended from the HIV task force that she serves on. So this bill authorizes a minor to give express consent to healthcare providers for certain services, including prevention of STIs and pregnancy. So we needed that in statute to be able to serve minors how we currently serve them. And we can now serve prevention of STIs, not just treat STIs, which is important for public health as well. SB 439, I also wanted to thank Jen Howell for, and then I missed my thank yous for SB 92, excuse me, to the food safety team. I really appreciate all of their help. Back to SB 439. This bill requires state and local agencies to develop policies to provide uninterrupted services to individuals diagnosed with HIV. This includes private and public detention centers and mandates that provide treatment and have resources in place to prevent acquiring HIV in their facilities. The bill does several other things. It was a big bill. It gives providers CEUs for trainings around HIV and requires certain public and private insurers to cover certain coverages, like to cover certain treatments around HIV. So that was a big bill and a heavy lift for the HIV task force, and Senator Dallas Harris did both SB 439 and SB 172. SB 441 eliminates the requirements for health districts in certain counties, meaning Washoe and Clark, to adhere to certain regulations that were adopted during the COVID pandemic regarding cleaning inspections in resort hotels and casinos. The bill removes all additional cleaning and liabilities from businesses impacted from what was SB 4 in one of the special sessions of 2020. I can't remember which special session, one or two. And then two bills that we were really happy to see die and go away was AB 168, which was a bill revising provisions relating to the Fetal Infant Mortality Review Board, a bill that had good intent, negative consequences. We fully expect to see this bill again, just hoping we will be involved in the conversation and money just won't be taken from us for the wrong reasons. So I wanted to thank Rebecca Gonzalez for that. She worked really hard with getting me the right information I needed at the very end. That was we were worried about that one till the very end. And then I wanted to thank Dave Kelly for SB 361, which we also managed to kill, I don't know a nicer way to say that, to bury it. SB 361 revises provisions relating to solid waste. This bill sought to exclude a type of waste termed advanced recycling, which would have been problematic for us in our solid waste management program. So that's like a top 10 list. Any questions?
Thank you. Any thoughts, concerns, questions? So my only question to you all, and today's not the day to do this, if not agendized for it fully, but in the future be thinking, we know that really session's already started now for the next 2 years. If there's anything that you guys are concerned about that we need to be thinking about on this health board, we'd like that to come back. And I'd love to hear from you, what are the things in the next 2 years? Because we know you work on them now to make sure they're ready when we get in there. So that'd be a future conversation. But I know for us personally, I'd like us an opportunity to speak into that.
Yeah, we will absolutely be focused on sustainable funding. And I would guess a lot of defense. Again, things like the FEMA, things like advanced recycling. We'll be ready for things like that.
Thank you.
Thank
Good
you.
job. Okay. We're moving on to staff reports and program updates, air quality management. Fernando, senor. Nice tie, we almost matched.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just want to highlight a couple of things on my report. First, the first part of my report continues to update the board on what's going on with the National Ambient Air Quality Standards. In this case, it was specific to ozone. If you guys recall, I don't know, about a year ago, the Air Quality Management Division committed to keeping the board informed on what's going on with these standards. In this case, the Science Advisory Committee reviewed the policy assessment from EPA and recommended that the ozone standard be strengthened between 55 or 60 parts per billion from 70 parts per billion as it currently stands. So that would be a significant change and would definitely have impact on our region. So I just wanted to mention that. I also included some information regarding legislation to proposed changing the updating of the standards themselves. And again, if that passes, that would have significant impacts. Currently, the review period for the standards is 5 years. This would change that to 10 years. And it also, I just mentioned the Science Advisory Committee is recommending a new standard for ozone. This would probably change that to mean that EPA wouldn't be able to change that until 2030. So that would affect that recommendation as well. So just wanted to highlight those couple of things and happy to answer any questions.
Any questions, concerns? John, you have anything?
No, I don't. I had a good talk with him a couple days ago, so.
Very good. Thank you so much. Thank you. Appreciate it.
Thank you.
And we'll move on. We have Lisa Latritz at Community and Clinical Health Services. Come on down.
Good afternoon again. Lisa Latritz, Division Director for Community and Clinical Health Services. Just a couple things to highlight. For our immunization program, we're gearing up for back to school. So we have 2 events, one on August 12th and one on August 19th. Plus we do have the Family Health Festival this Saturday at Hug High School. And just wanted to update the board about our HIV PrEP. In June, we started offering that in the clinic, and the demand is increasing daily. So that has been well received, and we were able to purchase generic PrEP medication so that we have it available in the clinic for clients. So that's exciting. And that's all I have, but I'm happy to answer any questions.
Any questions? I think we're good. Thank you so much. Appreciate it. Thanks for all you do. Moving on to epidemiology and public health preparedness, we have Dr. Nancy Dow. I'm sorry, I missed one. Robert Fida. Sorry about that, brother. We're going out of order here. Environmental Health Services.
Morning, board members and Mr. Chair.
It's afternoon, though.
Oh, afternoon.
I mean, it's okay. I think we put you to sleep back there, but.
Good afternoon. Robert Fida for the record, Division Director. And you have my board report in front of you, and I kind of want to highlight a few things. Our staff was able to respond to, our hazmat team was able to respond to a mercury spill at the library. EPA did get involved. They were able to assist us in kind of testing, and we were able to work with our agency partners to kind of contain that incident, and cleanup is still kind of ongoing at this point. The other thing that I would like to highlight is our vector program. They did their flight, I believe it was the 17th, and I would like to thank our vector staff for their tremendous effort in getting that up and running, as well as some of our Washoe County counterparts to kind of help us get through all the hurdles and everything in order to get this flight up and running. And one last thing I did want to mention to the board, and Joelle brought this up earlier, is that we are seeing increased aggression against staff from unpermitted vendors, and the public. And I just wanted the board to be aware of that. So, and that's all for my report. I'll open it up for any questions.
Any questions? John, go ahead.
How many areas did you wind up treating?
I believe it was close to 1,000 acres.
Okay, good.
And that was a helicopter we did with that one, right?
Yes. So the previous helicopter sold his business. One of his pilot, I believe, bought the helicopter and is in the process of getting his own business started up. So.
But we are still looking at doing the drones at some point.
Yes, that is, I was going to say, that will have to be discussed with the board. We'll have to bring it up. There is some legislative FAA rules that we do need to kind of iron out and see if the board is willing to accept liability on a few things. So, and I believe Dania may be able to explain more than I can, but.
Probably good to bring back for another longer conversation, sounds like.
See here. Yeah, there are some FAA rules, and perhaps not unsurprisingly, Nevada law doesn't dovetail well with what the FAA requires and the way that the health district is structured and set up. And so determining the appropriate entity for licensing based on the statutes as well as case law. I've been working with the FAA attorney back in Washington, D.C., and so we have some possible solutions that I think need to be vetted a little bit, probably with the board, and then we can see if we can move forward with that licensing.
Total. I mean, a lot of our cities are dealing with the same similar things. We're a little bit probably more positioned to move forward, but it'd be a good conversation to be had because there might be some help, some definite insights that we're dealing with as well between police drones and whatever. So, cool. Thank you. How long you been here now? 3 months?
Oh, I was going to say, I think it's 1 month?
1 month. Feels like 3. I'm just kidding. Good job, buddy.
Thank you.
Okay, Miss Nancy Dow, sorry, I pre-called you.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. Really quick highlights from my report more recently. So for outbreak trends, outbreak numbers, since dropping in May, we've seen that the drop continued in June, where we only had 4 declared outbreaks in the month of June. And then so far in July, that number remains low, which is good news. So to date, we had 3 outbreaks declared only, so 2 COVID, 1 gastrointestinal. Usually, that's what we will see around this time because school's out, and that's one of the major parts where we see a lot of these outbreaks happening. But so in August, September, usually we start to see that uptick happening again. EPI has always been having a lot of publications on a regular basis. Something to check out on our website to highlight is that we just posted the 2021 community antibiogram, which includes consolidated tables summarizing susceptibility of organisms to different antimicrobials. These are useful references for clinicians, infection control practitioners, microbiologists, or just anyone who's interested. And the 2022 antibiogram is also in the works for us right now. We have also just published last week the EPI News focusing on waterborne diseases. So that's illness acquired through exposure to water contaminated with pathogens. And in this issue, we focus on covering Giardia, Cryptosporidium, and we do want to be careful of that because these can result in a variety of very uncomfortable intestinal symptoms if you do contact them. So that's all my update. I'm happy to answer any questions you may have.
Thank you so much. Any questions? Sure.
Yeah. Are we seeing any seasonal increases in different diseases in nursing homes and like flu-related, COVID-related, since people are really more trapped inside now than they had been?
Well, one of the outbreaks that we did declare this month is in a skilled nursing facility. For flu right now, the good news is that flu still remains low, RSV is low. Yeah.
Is it just one like nursing home, or is it several, or is it the outbreak?
We do see that occasionally, because in a kind of a congregated facility, if it does happen, it does happen. But we're not seeing an outrageous kind of happening outbreaks.
More
right
within
now. So
normal.
That's good. Yes.
Okay, thank you.
Yeah, you mentioned RSV. You mentioned RSV. One of the things that I heard on the news, somebody was talking about they may have a vaccine or something.
That's
for
something under consideration right now with ACIP, CDC considering that. Yes, your answer is correct. That's something is being in discussion.
Gotcha.
Yeah.
Interesting. Okay, thank you. Any other questions? Okay.
Thank you.
Very good. Thank you so much. And now we go to our District Health Officer, Kevin Dick. What would you have, sir?
All right, thank you, Chairman. Just wanted to highlight a few things in my report. One is that we're continuing to work. I say we, but we're working to support Scott's efforts, Mr. Oxerart's, on the name change, and so working on the branding and everything that goes along with it. But we are planning on doing the name change launch on August 31st. So keep your fingers crossed that we can achieve that timeline. We have an event tentatively scheduled at this point for 11 a.m. With the media for announcing and rolling out the name change. So if anybody would be interested in attending that, we'd love to have you there for that. That said, I'd rather do a good job with launching our name change than try to hit August 31st specifically. So if we're not ready, we may push that back. Yeah. Lisa Lottritz already mentioned the Family Health Festival, but another reminder, that's this weekend at Hug High School. And I did send out to the board dates of and times of upcoming events that are happening through August, the back-to-school immunizations, and then some future flu pods. And you're certainly welcome to swing through any of those if you'd like to see how we're operating them. And I have an item that I included on PFAS that's per and polyfluoroalkyl substances, which are the forever chemicals. And I think everybody's aware of the sample that was analyzed that was pulled by a UNR student several years ago that just recently came to light that showed very high levels of PFAS in Swan Lake surface water. It's not a drinking water body. Tumwa collected some additional samples, and we have the results back from those. And the good news is that the levels are much, much lower than what was reported from that initial sample. And we don't have any drinking water well samples to know those concentrations. But there was an event that was held in June, and it was hosted by CSD for North Valley's residents. We participated in that to provide information for people with private drinking water wells, how they could get sample kits for sampling if they wanted to for PFAS, and also information about treatment options if water is contaminated with PFAS. We don't regulate drinking water wells as far as water quality. We permit their design and installation. And Tumwa does not have any results from sampling of their drinking water that indicate a PFAS problem. But also in June, the county decided to join in a agreement for legal services with a firm that's representing local jurisdictions across the country in regards to a potential lawsuit if there are damages from PFAS that have been caused by the aqueous firefighting foams in particular, I think is one of the areas of interest. So that's something that the Washoe County has joined into. So we're expecting more sampling to occur through a contract that the Nevada Division of Environmental Protection has this summer. So hopefully we'll get more information. Our information is really limited at this point, and NDEP is really the primary jurisdiction for the environmental assessment and any remediation that needs to occur. Then, on a happier note, we had a group that attended the National Association of County and City Health Officials, the NACHO conference. It was held in Denver. One of our board members, Dr. Novak, was able to join us. So I think a good time was had by all, but we also learned a lot during the session and had an opportunity to present in a session on the work that we've done with the National Public Health Foundation with our Foundational Public Health Services Capacity Assessment. So that was very well received, and it was a nice opportunity to share that work. I also wanted to thank Dr. Novak. He provided a couple of suggestions on firms that may be well suited to do the CCHS clinical assessment, and we've contacted them and have some meetings set up with them, so thanks for those contacts. I think we have some pictures. I also wanted to thank Dr. Danko for joining us on Tuesday for our Health Heroes celebration. And these, we're going faster. These are pictures of the barbecue that we had mid-month to celebrate our staff as well. And I wanted to thank Chairman Dare for attending the barbecue. We had some games and some prizes, and I think Scott took out the tower. And this is also last Friday. I wanted to thank Chairman Dare for joining us for the bill signing with the governor for SB 118. So this is out in Fallon, and I told Caleb Cage that they're planting their flag in the Washoe County Health District because they used it on the tablecloth, their new logo. So.
That's very cool.
So that. They are active now, and in fact, just yesterday I overheard our first staff referral of somebody that had contacted us to send them over to Central Nevada Health District. So I thought that was pretty neat.
Very nice.
Yeah.
Well, that is very cool. Well, very good update, and I do want to encourage you, if there's anything you guys go to, it's fantastic. The picnics or any of the stuff, I think it's just great for us to find ways to connect with staff, and I know we keep doing that, but we'll continue to do that. So thank you for going to the conference as well.
Learned a lot.
Good. Any other questions? It's only 2:04. We're doing really good. We're going to be out of here. I'm excited about that. So we're moving on to board comments. Any board comments, announcements? Mr. Novak, I see you're pushing your button.
Yeah.
Go for it.
I do want to thank Kevin and Aaron for getting together with these companies. They were vetted ahead of time, so we know they're interested, they have the capabilities, and to keep this above board, we want an outside group to come in and look at the good, bad, and the ugly that we're doing, and I know we're doing a lot of good, and I think the fact is we can expand maybe some of the things we do to even include more for our community, but to have a look at our community first before we go jumping and doing things. What do we need? What do we not need? There might be a few things we don't need to do. And I think that's where this whole thing, get an outside firm to go, I think is really important.
Any other board announcements? Sir? Very good. Well, we are moving on to adjournment. Happy July.